Thanks, Dean. I'd really like to take this opportunity to thank Mitch and Joe for putting me on last. Everything that's possibly been said has been, or could be said, has been said. And I'd also, yeah, thanks, Joe. And I'm the person that's keeping you between the presentation and lunch. So I've really got a challenge here. So I've got 8 minutes. And my talk was really sort of the to GP or not to GP, that's the question. And I'll tell you a little bit sort of, it was an interesting request on Mitch's part why I should talk about primary care, because Astellas, and I'll talk to you a little bit about our company, is primarily specialty based. But certainly Barb Reynolds and I, about 10 years ago, we asked this very question because we were moving into dermatology and really taking a look at it. When you're a specialty company going into primary care to a certain degree, how many resources are you going to put against it? So that's the title. So I've got a couple of questions just to get a sense. So how would you categorize your current business? Primarily GP based, and I put it at more 80% or greater, primarily specialty based, or a mix of both.
Michael let me ride his motorcycle. Michael let me ride.
So really sort of a split across the board. The next question is sort of so where do you see now, so that's where you currently are, where do you see your business in 3 to 5 years? Really with the same questions. So again, really a move towards specialty based, and this is something that we're certainly hearing with all the big primary care products either going off patent or the lack of these blockbuster products. So certainly we're moving in that direction. So the objectives of my talk, pretty straightforward. Address the question of deciding the overall importance of the GP market in your promotional mix. I want to challenge a couple of things, challenge a couple of the sacred cows that are out there. Offer some rationale for changing the current paradigm. Unadulterated plug for Astellas. We used to be the first and only Japanese company, but we'll always be the first. We're not the only anymore. We're in the top 20 globally. We have been here in Canada since 1995, and you see all the segments there, but certainly a very big research-based company. Our head office is in Tokyo. From a Canadian operations perspective, we'll be just shy of $90 million this year in sales. Here are the products that we promote, so you can see from a broad range, from primary care to a certain degree, certainly very specialty oriented in transplantation, immunology, cardiovascular, and hospital anti-infective. So really sort of a broad mix. But 10 years ago, we were very much a specialty-based company only. So our business models is really what we sort of split our businesses out as institutional based, really immunology, infectious disease. This is just strictly hospitals. We don't call on specialists outside of institutions. And from a community-based perspective, in urology and dermatology, we certainly call on a specialist in those areas. And this is where we had to ask ourselves a question, to GP or not to GP, because that was very significant for us. So from just another 2 more questions. As a company, have you purchased prescriber level data? Yes or no?
Those who swing, those who rate, they're the ones who know Pepsi is great. Those who move, those who go.
And certainly the vast majority have purchased prescriber level data. And this is more sort of a pet peeve question for me that I wanted to ask the group. Does your organization control the call list? So this is really, you set the call list for your representatives, really very little flexibility that you offer your people to go out there. It's basically, this is it, and you will follow the directive. So I'd like to get your sense of that.
Son, you're good for nothing, but let me tell you something. Get it into gear.
Interesting. Actually, that surprises me. So it's encouraging from my perspective. So I've got 3 more slides, 5 more minutes. I'm probably going to be pretty good, Joe, unless I keep going a little bit more. And I could, once I get on reach and frequency, I could go for a while. So factors to consider. Well, you know, certainly what we did at Fujisawa way back when, and certainly with Astellas, is I think as a company you have to consider the overall size of the market. I mean, if you're dealing in a blockbuster market, cardiovasculars, gastrointestinals, you know, products that play in markets of 300–400 million in Canada, that's a very important factor in terms of how far you go from a primary care perspective. But there are a lot smaller markets, and certainly markets that we play in within dermatology and urology, where those marketplaces are much smaller, that $50 to $100 million range, and maybe sometimes even smaller. And I think that's a very, very important factor that needs to be considered when you're looking at to GP or not to GP. The relative importance of customer groups really comes up. I mean, it was very simple for us as an organization when we were in transplantation and infectious disease.